presentation यहीं से.
Thank you so much.
Yeah, thank you. We'll go to David. First one? Yeah. Good evening, everyone. The most difficult part which has been given to me, that I need to talk about the whole day what we have done. And I know all of you are like hungry, you want to go to have your tea, and some of you want to chit chat whatever has been discussed. So I will not take much time of yours, and quickly I'll just take you through what we have discussed in entire day. And at the same time, I would also like to introduce our team who is tirelessly working for last 7-8 days to make this event happen. So, yeah. So we started our day where there was an inaugural session where DDG TV, Dr. Joshi was there, and Dr. Sachdeva from Union, he was there, and Joint Secretary from Government of India was supposed to come, but because of some urgent commitments, he couldn't come. So DDG and Dr. Alok Mathur were there, and with Dr. Sachdeva. So then there was a panel discussion where we had leadership from all the spheres. We had our global leader from Union side, Professor Guy Marks. Then we had Madam Sangeeta Patel from USAID. Then we had leadership from BMGF. We had leadership from Central TB Division, Dr. Mathur, Dr. Mattu. And then we had leadership from IQVIA. All of them were present. And a lot of discussions happened. And we had discussions about what is the global perspective and how this multi-stakeholder consultation and how these collaborative efforts can lead our efforts for elimination of TB. So under this, the main gist which had come out was the build component. All of us here are here. That program is doing whatever government can do. They are providing the diagnostic tool, they are providing the treatment for the patients, and all necessary support is there. But by this time, the day discussion, all of us are agreeing that TB is not an individual problem. TB is a public health problem. And for this public health problem, all of us need to join hands together, whether I'm an individual, I'm a corporate, or I'm from business association, or I'm from any line ministry. All of us, we need to join hands together and make sure that whatever all of us are dreaming for elimination of TB, which we are going to do by 2025. And we have discussed and we had taken the commitment that it is doable. And if it is doable, then all of us are here, and beyond this room, we need to talk about this and we need to take this initiative forward. And here we have seen that in various sectors how these practices are done. We had a presentation from Tea Garden side. We had a presentation where how youth can be engaged in this social cause. And then we had a presentation from Naira Energy where they have shown us that why nutritional support is important. And now this initiative has been taken up at the central level, and our Honorable President has launched this initiative at the national level and asked everybody to adopt TB patient for nutritional support. So again, all these models which we have seen, some have already been replicated, some have been further, they should become the national level models, and everybody has to contribute, and all of us have seen that the contribution from the team who is sitting over here is immense. Then we have discussed about Fujifilm, where we are talking about handheld devices that can be taken at the community, and where we are talking about community level screening. Those devices can be used, and we can showcase that India can also do, and India can also work towards elimination of TB. we had this session where we were talking about TB-free workplace. Again, it is a very important thing where Dr. Mattu has discussed about how ministry is closely working and how they are working for drafting the policy which can be given to all these industries and which the industries can also adopt TB-free workplace, which is a very, very simple thing where we have seen that we have a huge workforce for the formal as well as informal sectors. So all of us need to commit if somebody is heading the organization, as the head of the organization, we have to commit that, okay, wherever I am working, I have to commit that my space will be TB-free. So this is the movement which all of us have to initiate, and we have to become the part of this movement. Then we have seen that from Adani, how the workplace interventions can be taken up. Then we have seen the model from the BEST, which is again a PSU, and how there are more than 40,000 employees. They have been involved and they have been initiated this journey in their workplace. Then I come to the next session. Again, whatever we are doing, we require support from the government at the central level, at the state level, and we have seen that how our state TB officer, how our state STSUs, how our state teams are supporting this multisectoral engagement, and that we have discussed. We had presentation from state of Gujarat, we have presentation from state of West Bengal, then we had presentation how PRI's engagement can also happen for TB-free panchayat. And then we had a presentation from State TB Officer Maharashtra also. Then the last session, which was having discussions with various business associations and medical associations, and we have seen that a lot of trust is needed. All these associations, they have reach and they have already done a tremendous work with their organizations, so we require their support because it's a concerted effort now all of us need to put because time is running out and 2025 is not very far, so we require support from everyone over here. So now I would like to introduce our team who is working very closely, and for last 7 days, I believe all of us are working tirelessly to make this event happen, to make sure that all the presentation, all presenters, and whatever discussions we are having, it should give us a logical conclusion. So I would like to introduce our team first. I would like to thank our Central TB Division, Dr. Joshi, Dr. Mattu, Dr. Raghuram Rao, Dr. Ravinder. All these, we were getting continuous support from Central TB Division. Then from the WHO side, Dr. Mrigain, he is there. From NTSU side, Dr. Neeraj. And then from our team, we have Dr. Manu, Dr. Rakesh, then Dr. Shadab. Now I would request that all of us can stand and show your face that who is who. So I would request Shadab. Yes. So he's Shadab, he's the senior manager for corporate partnership, and whatever you have seen, all this because of Shadab here. Then we have Tripti Agarwal. Tripti. So again, Tripti is whatever you could see. It's a team effort, and thank you, Tripti. Then we have Ashish. Ashish, yes, show your face. He's the national consultant at the Central TB Division and providing all necessary support. We have Mrigain. Then Gulshan, you know by this time all of us are knowing who is Gulshan. Then we have Shrija. So all AV, Shrija is taking care of. So thank you, Shrija. Then we have Mithun. Yes. So with Shrija and Mithun, you could see whatever presenters, whatever bio, all presentations, without any interruption, we could do this. Then we have Abhimanyu. We have Hashit. We have Ashish from NTSU. He was, Ashish, you are there? Yeah. Shefali, yes. So this hotel arrangement, whatever food you are eating, and thank you, Shefali, all your support. We have Gunjan, Paulami, Arindam, Meenu, Devakar, Madhvi. Then now I would request Neeraj to introduce NTSU team. Over to you, Neeraj. So Neeraj first. So he is Dr. Neeraj Raizada, I believe you. Yes, we have Mr. Vijay Gupta. He is the finance and accounts expert from NTSU. Yeah, thank you. Mr. Amit Srivastav. Yes, thank you, Amit. He is contract manager expert for NTSU. Then we have Dr. Sandhya Gupta. She is the capacity building expert from NTSU. We have Mr. Arun Singh. He is the monitoring and evaluation expert from NTSU. We have Mr. Shashank Malviya. He is public-private partnership expert from NTSU. We have Debashish Sarkar. He is the DBT expert from NTSU. We have Mr. Ritesh Tyagi. He is the ICT expert from NTSU. We have Dr. Shanu Mishra, intersectoral engagement expert from NTSU. We have Dr. Nirja Arora. She is the project director, public health from IQVIA side. We have Mr. Babu, who had given us, who has created a link for us on the Zoom platform, and all our virtual participants who are able to join because of this. And then I would like to thank all our virtual participants who are continuously there with us since morning. And if I have left out any names, then I would request Neeraj or anybody from our team if I have missed out any names. Yeah, so now we were just thinking, because we have seen who all are working, who have worked for this. I would request now we can have a quick round of introduction, maybe. So we can just pass on music. So Gopal for all IT support, Dipankar for all your support, and Richard, yes. And please raise your hand if I have missed out. Yeah. So now I would request we can have a quick round of introduction. So from where we will start? Yeah, Gulshan, over to you.
नमस्कार, मेरा नाम दिवाकर शर्मा है. I am Diwakar Sharma. I am State Technical Advisor for Jharkhand from the Union. Thank you very much.
Hi, Shashank from the Union.
Hi, I'm Dr. Nirja Arora from IQVIA, formerly Union though.
Hi, my name is Shadab. I'm from the Union.
Hello everyone, Dr. Sandhya Gupta from NTSU.
Good evening everyone, Debashish Sarkar, DBT expert at NTSU.
Hello everyone, my name is Ritesh Tyagi. I am the ICT expert in IQVIA.
Good evening everyone, myself Shashank Malviya, PPP expert in NTSU.
Hello, good evening everyone. I am Dr. Abhimanyu Singh from the Union. Thank you.
Good evening everyone, I'm Shefali from the Union.
Good evening everyone, I am Isha from IQVIA.
Good evening everyone, I am Samiksha from IQVIA.
Hi everyone, I am Khushbu from Fountainhead Solutions. I am here to document the proceedings.
Hi, I am Bipasha. I am also from Fountainhead Solutions.
Good evening, I am Dr. Rajabhau Yole, Team Lead STSU Maharashtra.
Good evening all, I am Anirudh Pathak, working as an intersectoral engagement expert, STSU Maharashtra.
Hi, good evening, I am Dr. Prabhu from WHO.
Hi, I am Ruma Banerjee, ISC expert from West Bengal, STSU.
Hello everybody, I am Dr. Asha Rao, Team Lead, STSU West Bengal.
Good evening, Dr. Suryavanshi, National WHO Consultant from Central Tip Division.
Good evening, I am Dr. Aniruddha Kadu, State Headquarter Consultant, WHO.
Hi, I'm Raman from the ACSM NTSU from the Union.
I'm Dr. Dinesh Baliga from WHO, stationed in Lucknow.
Good evening, everyone. My name is Dr. Arvind Kumar. I am WHO consultant for Himachal Pradesh.
Good evening, everyone. I am Dr. Satish Pundir. I am based at STDC, Himachal Pradesh.
Good evening, everybody. I am Dr. T.K. Tondar, State TB Officer, Chhattisgarh.
Good evening. Dr. O.P. Prasad from Goodrich Group Limited, the tea people.
Good evening. I am Dr. Vinod Garg, STO Rajasthan.
Good evening all. Myself Dr. Arif, WHO consultant from Jaipur.
Good evening everyone. I am Dr. Richa Sharma, team lead STSU Rajasthan.
Good evening everyone. I am Sangamitra, intersectoral engagement expert, STSU Rajasthan. Thank you.
Good evening. I am Sangeeta, STSU Karnataka.
Good evening. I'm Dr. Prarthna, STSU Karnataka.
Good evening, everyone. I'm Dr. Shobha, and I'm Chief of Party for the Tribal TB Program, Piramal Foundation.
Good evening, everyone. I am Dr. Srigana, WHO, Telangana.
Good evening, everyone. I am Dr. Mahesh, WHO, Telangana.
Good evening, everyone. I am Dr. Ishfaq Nazir. I am the WHO consultant for Jammu and Kashmir.
Good evening. I am Ashish Verma, National Consultant placed in CTD.
Good evening. Vinay Kumar Singh, Intersectoral Engagement Expert, UP.
Hello, good evening everyone. My name is Bharat Shetty. I am working as a team leader TSU based for UP based at Lucknow. Yeah.
Good evening, Dr. Reynald Washington, Senior Technical Advisor, the India Health Action Trust, IHAT.
Good evening, Ranjit Singh from ASSOCHAM, India.
Good evening, Paulamy, Corporate Engagement from the Union.
Good evening, myself Arvind Chatterjee. I am State Technical Advisor, the Union.
Good evening, I am Commodore Raman Arora. I represent CETI and the Union currently.
Good evening, Mahendra Pancholi, TLTSU MP.
Good evening all. Binoy, Deputy Team Lead, STSU Madhya Pradesh.
Good evening everyone. Darpan Chobe, Intersectoral Engagement Expert, the STSU MP.
Good evening everyone. I'm Mr. Srivastava, Contract Management Expert, NTSU.
Hello, good evening. I am Vijay Gupta, Finance Expert at NTSU.
Hi everyone, I'm Anu Suresh. I work in the capacity of Director of Grants and Impact Generation at Cure.ai Technologies.
Hi everyone, good evening. Rijesh Bose here. I work as a project manager with Cure.ai. Thank you.
Yeah, I am Dr. Subrat Vanda. I am the WHO State Headquarter Consultant from Odisha.
Hello, good evening everyone. This is Dr. Umesh from WHO.
Good evening everyone. Dr. Sukhwant, WHO Consultant, Haryana.
Good evening everyone. Dr. Satish Manji, WHO, Punjab.
Good evening everyone. I am Dr. Vikas Sabharwal. I am the State Headquarter Consultant for the state of Madhya Pradesh. Plus I look after Gwalior Chambal Division as well.
Hi everyone, myself Dr. Ranadeep from WHO. I'm looking after the state of Arunachal Pradesh. Thank you.
Good evening everybody, myself Dr. Ranjit Prasad, State TB Officer, Jharkhand.
Good evening everybody, I'm Dr. Raju Pathak, WHO Consultant for Jharkhand.
Good evening everyone, this is Sanjeev Rai from Indian Oil Corporation, Lucknow office.
Good evening, everyone. Myself, Shashi Chandraman from Corporate Office, Indian Oil Corporation Limited.
Good evening, everyone. This is Dr. Prakriti Kashyap from Doctors for You.
Good evening, one and all. I am Akbar Hussain, Team Lead, STSU Bihar.
Good evening, everyone.
I am Harun Rashid, intersectoral engagement expert, STSU, Bihar.
Hello everyone, I'm Director TB at Empower School of Health, which is a partner for iDefeat and the Union. I'm also Director Programs at Share India. He was introduced as the main guys, amongst the main guys.
Hi, good evening. Arun Singh Rana, I'm part of NTSU team in a M&E expert position. Thank you.
Good evening, everyone. I'm Dr. Rachna Vishwajit. I'm WHO consultant based in Mumbai, and I also have the thematic of multisectoral coordination for Maharashtra. Thank you.
I'm Dr. Bipra Vishnu. I'm the WHO headquarter consultant in West Bengal.
Good evening, everyone. This is Satish Kumar, intersectoral engagement expert from STSU, Tamil Nadu.
Hi, good evening, everyone. Dr. Arun Gangadhar, team lead, STSU, Tamil Nadu.
Hello, everybody. This is Dr. Shazia, WHO consultant at State Headquarters, Karnataka.
Good evening, Dr. Delphina Pathinathan, WHO consultant from Tamil Nadu and Pondicherry.
Good evening, everyone. This is Dr. Suma, WHO consultant, headquarters from Tamil Nadu.
Hi all, I am Gayatri, WHO consultant, Kerala and Lakshadweep.
Good evening, all. I am Dr. Aparna Mohan, WHO consultant, Kerala.
I'm Dr. Charuta Gokhale, consultant research, Central TB division.
I am Dr. Jani, WHO consultant, Gujarat.
Good evening, everyone. This is Dr. Dheeraj, National Consultant Research, WHO Central TB Division.
So thank you, everyone, for your brief introduction. With this, we come to the end of today's session, today's agenda, day-long agenda. Tomorrow would begin with new ideas and new innovation, and we'll hear from industry experts. I would like to request Dr. Manu Matthew for a brief closing remarks.
Okay, sorry. Okay, so again, another formality, so keeping you away from this thing. So generally, I think Dr. Jyoti has said thanks to most of you. Thank you all for joining us today. We have tried to stitch a lot of pieces together and with the help of a lot of people. Thanks to all of them, not mentioning anybody individually. So closing this formality, thank you all for joining us today. There is a networking dinner post this session, so please do join us for dinner. And that's it. Okay, that's it. Okay, thank you all.